Okay, we're going to do a few questions and answers here so you can get a better understanding. If you have any questions, let's go ahead and we'll take those now. The difference between a headache and a migraine, as I tried to explain, is that a severe headache is just a mechanical pressure caused by the trigeminal cervical nucleus, creating a vascular response that causes the blood vessels to vasodilate and the pain fibers are around that. Now, a migraine typically is more one-sided, begins on one side and then it can go to the other side. It also has the vascular event, which means you get very sensitive to lights, very sensitive to hearing and to smells. Many times people have to go into a dark, quiet room because that migraine is so intensified. And then the body not only has the mechanical pressure from the blood vessels, but it also releases serotonin into the bloodstream, which is excitatory to pain. That's a chemical depolarization of pain. And now the body has to come in and absorb those. So the better your body is at absorbing is, and as far as your detoxification system, then the better or the faster those migraines are going to go away. But we find in most migraine patients that they're sensitive to foods, they're sensitive to environmental stimulus, and other type of factors. So again, their bucket is full to start with, so we have to help them detoxify as well. I believe the question is, I'm doing all these other things. My doctor says I have to get off of dairy. My doctor says I have to get off red wine. I have to get off chocolates. I have to detoxify. All those things are great, but those are what? Constants or non-constants? They're non-constants. I can tell you the muscles firing and how the teeth come together at least 2,000 times a day and how the cervical spine works. Those are called tonic or constant receptor input. So I can take away the non-constants, but wouldn't it make more sense to balance the constants? Once I balance the constants, I get everything to come back into normal. I empty out the bucket. Then things that are good for me, I mean, red wine, 1 or 2 glasses a day has a lot of antioxidants. It's good for the cardiovascular system and the other. So why is it good for one person and not the other? Because it's this constant balance that we don't have. And what we've done in the program is that we've actually brought in the best rehabilitation therapies on planet Earth. We use ultrasound, we use manual trigger point therapy, we do microcurrent, we do cold laser therapy. We give you tools to use not only during the treatment period where you're going to be with us, but we give you tools to treat yourself for the rest of your life. Just like you have an injury. Have you ever had an injury to any particular area, like an elbow, a shoulder, or a knee? I was 18 years old. I got in a bad car accident, right? Someone turned left in front of me. I was in my car, I hit them, I hit the steering wheel, I flew in the back seat, and I actually broke my 5th vertebrae, okay? Now that was when I was 18 years old. So this is an injury I'm gonna have for the rest of my life. Now the joints and the muscles are just like anywhere else in the body. It's a small joint, but it's an injury nevertheless. This becomes one of the weak links, just like my back is. But what do I do to help my back? I stretch, I swim, I do a whole lot of things. And guess what? I don't have much back pain and I don't have any leg pain or tingling or numbness. The same thing happens is that when we have an injury of this nature, we're going to have to do things throughout the rest of our life to maintain that, whether it's once a week or twice a week. Maybe in some people it might be 3 or 4 times a week. But during the therapy part, we're going to treat on a daily basis in order to break the pain pathways. You need to understand that just like learning to play the piano or the guitar or learning a new language or whatever the skill set must be, the more you do it, the more efficient the nerves become. That means that one nerve and another nerve gets a connection. It's called a synapse. What was the difference between Einstein's brain and a typical brain? Was it the number of nerve cells or was it the number of synapses? I can tell you that he had 100 times more synapses or connections than a normal brain. Not nerve cells, but these connections. Now, when I do this activity, where it's the piano or whatever it might be, or pain, the more I have it and the more I do it, the more efficient the pathway becomes, or the more connections from one side in relationship to the other. So how do I break that pain pathway? I do that by using microcurrent, cold laser, and exercises that fire the nerve appropriately. When we do that, it actually releases a little neuropeptide that actually breaks the bond from one nerve cell to the other. And over time, guess what? The pain goes away. But this is something that needs to be done on a daily basis. This is why we give you tools so you can treat yourself at home. So instead of having to go into a physical therapy or chiropractor or massage therapist for 3 or 4 times a week for 6, 8, 10, 12 weeks, we can have you come into our office for 1 time a week, and you're going to do your exercises at home. Those are going to be using microcurrents. We're going to use exercises to break these pain pathways. So I need you to understand that the longer you have pain, the more efficient, unfortunately, that nerve pathway becomes. And the only way to break it is you have to fire the nerve appropriately. We have nerves, and in the nerves are basically 3 types of fibers. We have a large fiber, which is an A fiber, which controls muscle spindles, vibration, joint mechanoreceptors, and a B, which is a medium fiber. And then we have the little C's. The little C's are the pain fibers. They're what we call demyelinated. That means that they really don't travel very fast. They're very slow. So let me give you an analogy. Pain travels a football field in about 20 seconds. That pain fiber, if it was a C fiber, if I put it on 0 and I went 100 yards, travels that 100 yards in 20 seconds. How fast do the large fibers travel a football field? That 100 yards in 1 second. So even innately as a kid, let's say I fell down and I sprained my wrist, or and I hurt it or I scratched it. What am I going to do? What's the first thing we do, even innately? We usually rub it or shake it to fire the large fibers to inhibit those slow feed fibers. And that signal goes to the brainstem. Remember, 80% of the pain fibers stop at the brainstem, and that will even decrease it going to brain itself. So remember, if we start to have trauma, such as I get in an accident, I fell, I have a sporting injury, I'm clenching and grinding my teeth where I'm getting these muscle spasms and these windups here, where I had a shift in my physiology through orthodontics, what happens? Does that muscle, is that scar tissue, does that tight band, does it travel as fast to brain as it did before? No, remember, brain only knows a frequency of firing. So if it's now coming in slower, it thinks it's pain, not muscle movement, because the brain only knows the frequency of firing. In the hearing center called the temporal lobe, we don't have a piano area, a guitar area, a violin area. It's a learned response from the frequency in which it comes in. The brain only understands a frequency in firing. So remember, it's called the gate theory of pain. The better our muscles and our joints and everything move, the more that we inhibit pain. Many times when you're not feeling too good, you get out and do some exercise, fire some endorphins, they go into the spinal cord. That's also inhibitory towards pain. So that's the idea. We have to get motion. We have to get balance. When we do that, we start to empty the bucket. And guess what? We can go back to doing a lot of the things that we want to do.